Good morning.
Good morning.
Today is the 21st of May, the time set for the budget meeting of the Central District Health. I'm Commissioner Beck, I'm Chairman of the Ada County Commissioner. I'll be chairing today's meeting and representing Ada County. I'll call the Public Health District 4 Budget Committee meeting to order right now, today at 8:30. To consider the proposed fiscal year 2022 budget for Central District Health. The Budget Committee consists of the chair or designee of each of the county commissions within District 4, which includes Ada, Boise, Elmore, and Valley counties. Each county will cast only one vote. Do we have any written proxies?
Yes, Mr. Chair, we have a proxy from Elmore County. The Board of Commissioners have delegated the authority for the vote for Elmore County to Board Chair Betty Ann Nettleton.
Okay. Do we have Boise County online? Is Boise County with us?
Donna, do you know if Ryan was able to join this morning?
Ryan did not confirm either way.
So, and we do not have a proxy for Boise County.
Correct.
All right. We have Elmore County is, who's
Yes,
the proxy
that's
for it?
That's me, Betty Ann Nettleton. I'm here.
Okay, thank you. And we have,
Bill Rick, Valley County.
all right. Are there any changes to the agenda?
No changes to the agenda, Mr. Chair.
All right, we have, we're going to vote on the minutes of the May 15th, 2020 Public Health District 4 Budget Hearing Committee meeting. In reviewing the minutes of the Public Health District 4 Budget Committee meeting on May 15th, do I have a motion to approve the minutes?
Motion.
Go ahead, Betty.
I move we approve the minutes from the May 15th, 2020 Budget Committee hearing.
I will second that. This is Mr. Asper.
All right. I'll call for a voice vote regarding the motion to approve the May 15th, 2020 minutes by county. All those in favor, say aye.
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 That's Commissioner Sturm.
Commissioner Sturm, you joined us. Hello?
Ryan, are you on? Apparently not. So who was the fourth vote? This could be fun.
Yeah. Who just voted for Commissioner Sturm?
We won't count it
We
then.
won't count it. So 3 ayes.
Yeah. Motion carried then. Now we'll have a discussion on the proposed FY22 Central District Health budget. In accordance with Idaho Code 39-423, the Budget Committee will now consider Central District Health fiscal year 2022 budget. The county contribution includes a 3% increase from the fiscal year 2021 budget. In addition, an additional $689,000 as a result of House Bill 316. Total county contribution of the proposed fiscal year 2022 budget is $3,276,469. The proposed fiscal year 2022 Central District Health budget, including all fund sources, is $13,873,000. I'm going to ask Director Duke if he could pose for the record or present for the record some of these increases. I notice you've got a 25.8% increase in personnel costs. Could you, for the record, tell us, is that temporary or is that going to go away next year?
Mr. Chair, thanks for the question. Most of that increase will go away. We always have a few additional staff coming on board or leaving the agency based on grant funding sources, which tend to be 1, 2, 3 year periods of time. But the majority of the increase, both in FTE as well as the 25% increase in the personnel budget, will transition away throughout the course of fiscal year 2022. Most of those new positions have been added to CDH for the COVID response, and the money paying for those positions is federal money coming primarily through the Department of Health and Welfare under contract.
Okay, now the operating costs, you have a 12% increase in the operating costs. Is that a temporary increase, or is that, what's that?
Some of the operating costs, in fact, most of the operating costs will remain. So a large portion of that increase is the Valley County Opioid Response Project that we received a 3-year grant for. So the COVID response is primarily going to affect personnel costs beyond, as far as a reduction beyond the fiscal year 2022 cycle.
And the county funds has a 30.5% increase. I suppose that's because of the House Bill 316 that changed the way we're doing the designation of the county funds, and so that's been prorated on March 1st.
Mr. Chair, that's correct.
And the state general fund for this year is minus 26%. The same thing there?
Correct.
Now, are we positive that the trustees will grant that much money to the Central District Health?
That's a really great question, and maybe one for Commissioner Hasbrook to answer, because he is the trustee, but up to this point, there has been no discussion among the trustees to change the formula from what it has been for the last couple of years. So I have no reason to believe it would be at the last hour if that effort would be made. So I would be 99% confident the budget that's before you as far as the state general fund share coming to Central District Health is accurate.
And to comment on that, Mr. Chair, in our last executive council meeting, we did discuss the fact that we felt it was wise to continue with the same formula we've been using for the last 2 or 3 years and not to do a big jumble or shift right now.
Okay. Now, I just have one final question on the reserve. What is the reserve fund balance for?
So I don't have that number in front of me. So we're not drawing any reserve funds for the purpose of this budget as we have in the past, but that's information that I would be able to share with the budget committee. So we have a couple of reserve fund designations, capital reserve and an operational reserve. In fact, we have Laurel McMahon, she's our support services division administrator. Laurel, do you happen to have that information readily accessible to you where you could share that with the budget committee?
Yes, I do. So the total reserve fund designation MARA balances right now is 3.6 million. And that includes the personnel reserve fund for the 27th pay period, the operational reserve fund, and the capital reserve fund. So it's a total of all of those.
Mr. Chair, I was just going to add the bulk of that money, right, sounds like a pretty big number, is for the operational reserve fund. And Legislative Services Office, they have traditionally done our audits, our fiscal audits, and they have recommended to all the public health districts that we have a operational reserve fund balance equivalent to about 3 months of our annual budget. So we're not quite there, but we're getting close to that point. So that, again, is a recommendation from the legislature, the Legislative Services Office.
Okay. I'd like to add right now that your budget has been presented to all 4 boards of county commissioners, correct? And is there any further discussion from the board today?
No, but I think you might pay Laurel, and next time we do this, is to have that reserve in here and have it, I think some of it is, but not all of it, and have it broken down so everybody knows. I know on page 5, we talked about the capital outlay budget, which is pretty small, $254,000. Kind of shows our future purchases and future expenses that we're going to do on facilities. But I think just for That's what I'm looking for. Exposure to the public and the whole world, that'll be included in this.
Okay. I'm ready for a motion to approve the budget for the 2022 fiscal year for Central District Government. Do I have a motion?
Mr. Chair, this is Commissioner
Go
Haslam.
ahead, El.
I'll make the motion that we approve the FY 2022 budget request.
Is there a second to the motion?
This is Betty Ann Nettleton. I second.
Okay, thank you, Eddie Ann. Is there any further discussion on the motion? With no further discussion, I'll call for a voice vote regarding the motion to approve the fiscal year 2022 budget by county. Boise County. Elmore County.
Yes.
Valley County.
Commissioner Hasbrook, aye.
Ada County. Rodbeck, aye. Motion has been approved to accept the FY22 budget as presented to begin July 1st, 2021. Is there any further business that needs to be brought before this body? Hearing none, I'll accept the motion to adjourn.
Also move.
Do I have a second?
Betty Ann Nettleton, Elmore County, second.
Been moved and seconded to adjourn the budget committee. All in favor, say aye. Aye.
Aye.
We're adjourned.
Very nice to them.
Well, thank you.
Thank you.
Basically now, meeting will move over to the Board of Health meeting, that you don't worry, you're welcome to stay as long as you would like.
I can stay for a few minutes, sure. I can't stay the whole time, but I can stay for some. This is your agenda here?
I think so, it's a whole packet.
Oh, okay.
So Madam Chair, we're ready to begin with the Board of Health meeting whenever you're ready to call it to order.
Okay, thank you, Russ. This is the convening of the Central District Board of Health meeting for Friday, May 21st, 2021. It is 8:40 a.m. and I will call the meeting to order at this point. Let me introduce myself. I'm Betty Ann Nettleton, representing Elmore County, along with Representative Megan Blanksma. And I will take roll call by county, starting with Ada County. Dr. Young.
Jane Young here.
Dr. Epperly.
Ed Epperly here.
Raul Labrador. Okay, I'm going to hear. Boise County, Commissioner Sturm. Elmore County. Did I hear Ryan try to join us?
I think I was muted, so I'm here.
Oh, okay. Elmore County, did I hear you, Megan?
I'm here, yes.
Okay, thank you, thank you. Valley County Commissioner Hasbrook?
Commissioner Hasbrook, I'm here.
Okay, thank you, folks. All right, proceeding with action items to our agenda. Director Duke, are there any changes to the agenda?
Madam Chair, we have no changes to the agenda today.
Okay, thank you. Proceeding on to new business, we need to approve our minutes from our April 16th, 2021 board meeting. Is there any discussion or corrections on those? If not, I would ask for a motion for approval.
Oh,
I move to approve the minutes. This is Jane Young.
Thank you, Jane. Is there a second?
Ed Epperly will second.
Thank you, Dr. Epperly. Okay, I will call for motion, vote by county for approval of those minutes, starting with Dr. Young.
Jane Young, yes. Aye.
Dr. Epperly.
Ed Epperly, aye.
Boise County, Ryan Sturm. I'm getting a little bit of static. I think maybe Ryan's there, but I can't understand him. Elmore County, Megan Blanksma.
Megan Big Aye.
Okay, thank you, Megan. Valley County Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you. The motion to approve our minutes from our April 16th, 2021 board meeting have been approved as presented. Okay, moving on, we need to hear from Laurel McMahon on our 2021 financial report. She is our Support Services Division Administrator. Laurel, good morning, and the floor is yours.
Thank you, Madam Chair. Good morning. We have the standard report up on the screen, and I'll just start off by saying there are no changes this month, different from what we've been seeing over the past several months. So through the end of April, that brings us to 83.3% of the budget year. And you can see our total revenue is at 97% of the budgeted amount. So we're higher than that 83.3%. Fees are high compared to the budget in both FCS and CEH. Our total contract revenues remain high, the same as they have throughout the entirety of the fiscal year. And our other revenue is also above budget at this time. As a reminder of what goes into that, that's the state home visitation funds. They're showing up in the family and clinic services. And in CEH, we've got the WICHC, the Citizens Review Panel, and Millennium funds included in that amount. That's why you see those high numbers there. Looking at the expenditures, they're at 82% in total, so right on budget there. And as a reminder, those numbers got much closer to budget when we did the revision process. So the revisions were accurate and we're right on budget where we expect to be. Personnel is at 86% now, so just over. But again, we did adjust those numbers down due to charging to COVID funds instead of the normal funding sources. So that's why you're seeing them so close to budget now. Operating is under budget at 72%, and typically we do spend a little more on operating over the last couple months of the fiscal year as we wrap up our operations and year-end projects. Our capital outlay balances remain the same as they have for the last several months. One item to note here is that we have spoken with the contractor about resuming the remaining remodel components. That's the carpet, paint, and furniture. And we're expecting a quote on in the next couple of weeks. So depending on what that quote is and the proposed timeline, we may see some of this expended before the end of this fiscal year or possibly into the beginning of next fiscal year. Looking at page 2 of the report. The fees, as we've talked about, are higher than they were at this point over the past couple of years. And again, you can see here represented a little bit different, but just a specific number of where the state home visitation fees are, and those are coming in as anticipated. And when you're looking at contracts, we still see that big jump there in the CEH contracts, and that's where you can see the COVID funds coming in. And we do have our separate report on COVID funding, so we'll cover that more specifically next. Slightly different look at personnel and operating costs. You can see that personnel is slightly over, as we talked about on page 1, and operating is under. And then there's the same balance of our capital outlay budget. And we will see an end to that before the end of the fiscal year, but it may be beginning of the next one. Then we can move on to page 3. And you will notice a little bit difference in layout in page 3. What we did is combine pages 3 and 4. So it looks a little bit different than it has over the past couple of months. But this is a summary of our reserve fund designations and our cash balances. And we thought it would be more concise and a clearer representation of what all those balances were to put them on one page rather than have it in 2 separate pages. So this report shows our total cash balance of over 6.3 million. Deducting those reserve fund designation balances leaves us an undesignated cash balance of 2.7 million. And that's the summary of this report.
Well, this is I like page 3. I like how you did that.
Thank you, Commissioner Hasbrook. We'll keep with this format. And any questions before moving on to the COVID report? Okay, we'll move to the COVID report. And as it's being pulled up, I'll tell you that we do have a couple of new funding sources here. So you'll see those. Okay, and here we've got the screen. So the final 2 grants in the middle section of grants, the HC 233-200 and the COVID Capacity CARES Act grant, those are 2 new funding sources from what was on here last month. We also added a funding end date column because just to show that when these grants are supposed to go through, we've had a couple questions about that. So I thought it would be better to include that column there so that you can see when the grants go through. As a reminder, those bottom 3 grants are also used for public health preparedness operations and epi surveillance, so it's not just for COVID funding. And then to talk about our balances here, our total expenditures are at 4.3 million. They were at about 3.9 million last month, so a difference of about 400,000 there. And then last month, our remaining balance was at 1.9 million. This month, it's gone up to just over 2 million, and that's because of the new funding source that's represented there. Okay, and I will move on to the FY22 fee schedule, proposed fee schedule. So this will be, as it comes up on the screen, the proposed FY22 Environmental Health and Family and Clinic Services fee schedule. With board approval, these will be effective July 1st. To start with, I'd like to do a quick review of our fee development process. So we adhere to state statutes and rules to any relevant program requirements, federal program rules in particular. When we go through the fee setting process, our division administrators, program staff, Michelle and I also consider the following: current cost for providing services, reasonableness of fees in comparison to other fees imposed by similar entities, standard reimbursement amounts to third parties, and also clients' ability to pay. So today we're starting with the family and clinic service fees. This format looks a little bit different than it did over the last couple years. We are comparing what it was last year to the proposed fee for this year, so you can see the differences clearly. For our family and clinic service fees, we used the new process that we implemented a couple years ago for establishing the proposed fees, and it's a little bit of a complicated procedure for this. We use a relative value unit, and then we multiply that by a set conversion factor. That RVU unit is a national standard. It's commonly used by third-party payers as a measure of the relative value of a service. So these fees are in alignment with major third-party payers. For the first few fees, a CMS RVU is not established. We use the standard Medicaid reimbursement rate instead. And as you can see, we've got the proposed fees in comparison. This year, most of the fees most of the proposed fees have gone up by $5 to $10 per service. And that's based on increased costs, change in that RVU and the conversion factor. And we were able to keep them pretty close, but they do go up by $5 to $10 a fee in most cases, unless they're set and need to remain the same. And then we can look at our environmental health fees. There's the second page there.
This is Commissioner Hasbrook. I have a question on the clinic fees. Since we're trying to encourage people to get vaccinated for coronavirus, are you guys, or did you guys have a discussion about the proposed $50 fee for that, the first top two? Why did you go to $50?
And that is what we bill the provider. That's not a cost to the patient themselves.
So then if someone orders the vaccine, that's what they would, a provider orders the vaccine, that's what they would have to pay for it?
I am not exactly sure how that process works. I know that the patient isn't having to pay. Getting a message that the vaccines are free and we write them off. But I can provide a more specific description of how that process works if you'd like and follow up.
Madam Chair.
Typically,
Yes, go ahead, Ted.
yeah, I was just going to say, typically what's done is that charge is charged to the commercial insurance company, Medicaid or Medicare, depending on the insurance of the patient. If the patient was uninsured, that might be a cost that would go to them, but for all others, the cost goes to whatever their payment source is, their insurance company.
So, Madam Chair, this is Elt again.
Yes, Elle, go ahead.
So Ted, I'm a little confused. If this is an indigent case and this person gets a vaccine, is the county going to get this bill?
I think that's probably out of pocket, unless there's a nominal fee that on a sliding fee that CDH is using. And Russ, you were just getting ready to maybe address that. Typically what happens at some places else is for people that are below 100% of the federal poverty level, there's a sliding fee, which CDH has as well. And there's usually a nominal fee like $10 that's charged. But I'll turn that over to us specific.
Yeah, Madam Chair, this is Russ, and I was going to ask Chris Payne. She's our division administrator for Family and Clinic Services, and she can answer questions as far as this specific fee or any of the other fees that are being presented.
Yes, Chris, are you there?
Yes, Madam Chair.
Go ahead.
Yeah, at CDH, Dr. Epperly, thank you for jumping in. Your explanation is spot on. We don't balance bill the client when they fall below that 100% of federal poverty level. It would be a write-off or a no charge to the client. We bill the administration fee on a vaccine if there is insurance, and we do not turn a bill over to the county.
Madam Chair, this is Zelda. I have a question for Chris.
Yes, El, go ahead.
Chris, is this just for the Moderna, or is this all vaccines for Corona? Like the AstraZeneca, Pfizer, and all that?
Madam Chair.
Yes, Chris, go ahead.
Commissioner Hasbrook, currently CDH in our Family and Clinic Services, we are only offering the Moderna vaccine. But for any vaccine, we would apply the same process. If there's insurance, we would bill for the administration fee. And if a client ended up in the no charge based on the slide, then we would have a write-off.
Okay, thanks, everybody. I just want to make sure we're not pulling back on the reins on vaccinations.
Okay, thank you. Laurel, do you want to proceed with your presentation? Are there any more questions for Laurel at this point?
Okay, Madam Chair, I'm happy to proceed, and we can go to the environmental health proposed fees, please. Okay, and this format for environmental health fees looks similar to what you've seen in the past. Here we have the FY21 fee, the FY22 proposed fee, and then the actual cost for FY21. So a few things to note here. If you see an asterisk by the cost, that's where the fee is set by rule or statute. If you see a plus sign next to the proposed fee, that's where the cost is going down, and that's due to a reduced cost. And if you see two plus signs, that is a proposed increase to the fee. So if you do just a quick glance down the list, you can see that almost all of our fees have gone down in environmental health, with the exception of a couple that stay the same due to rule or statute. And then at the very bottom, for our other services, there are a couple of proposed increases, or sorry, that's in the food license fee. There are a couple of proposed increases for our Serve Safe classes. And the cost of those has gone up slightly over the last year with smaller class size. But other than that, we've been able to reduce costs and thereby propose reduced fees to go along with it.
Madam Chair, this is Al. I just want to say this is really good news, especially on the septic systems. Being in Valley County, we catch a lot of slack about fees for septic and permit fees, and this will be great. We can take this back home and gonna make a lot of people happy. So this is good news for me.
Yes, thank you, El. Any further discussion or questions for Laurel?
Madam Chair, this is Jane. I had a quick question.
Yes, Jane, go ahead.
Who monitors the write-off from the commercial insurance companies on the clinic services charges?
Madam Chair, I would turn that question over to either Michelle or Chris.
So Michelle or Chris, go ahead and weigh in.
Yes, Madam Chair, this is Michelle. We monitor those in my area, our billing for DoseAdministered, to show all of these write-offs. And we presented to one of our committee meetings for our FCS. Chris, do you have anything you wanted to add?
Madam Chair,
Yes, go ahead. I'm not sure who's speaking.
this is Chris.
Oh, hi, Chris. Go ahead.
Hi, apologies. Yeah, Michelle's correct. If there is a request for a write-off or we find ourselves in that situation, we usually discuss it at a clinic integration team meeting. But typically, we have only seen less than 10 write-offs over the course of the past year or so. It's very few instances.
Follow-up question, then how do we know we're charging what insurance allows?
Madam Chair, this is Chris.
Yes, Chris, go ahead.
If I'm following that question correctly, Dr. Young, when we assess our fees through the process Laurel described, we're charging competitively what we're allowed in our contract with our conversion factor and RVU process. So if you would need more information, I'll need to probably get back to you and the committee on this.
Awesome, thank you.
Okay, thank you. Any further questions while we have Laurel here? Hearing none, we need to have a motion for a vote on the proposed fees for 2022. Do I hear a motion for the?
Yes, Betty Ann, this is Ted Epperly. I'd make a motion to approve these schedules as presented.
Okay, thank you, Ted.
And
Is there a second?
This is Jane, I second it.
Okay, thank you. Having heard no further discussion, I'll go ahead and call for a vote by county, starting with Dr. Young.
Jane Young, aye.
Dr. Epperly.
Ted Epperly, aye.
Raul Labrador. I'm not hearing Raul. Boise County, Commissioner Sturm. Elmore County, Representative Blanksma.
Blanksma, aye.
Okay, thank you, Megan. Valley County, Commissioner Hasbrook.
Commissioner Hasbrook, aye.
Okay, thank you.
Raul
Right.
Labrador, aye.
Okay, what was your vote, Raul?
Aye.
Okay, thank you so much. Okay, those fees stand approved as presented, and thank you, Laurel. Proceeding on with our agenda, I will ask Russ to talk about the IRIS legislation that was discussed at our April 16th meeting. Russ, go ahead.
Sure, Madam Chair. Really not much has changed since that discussion. What I was asked to do was to present on IRIS legislation that may have been intended to somehow compromise the system as it exists today. So in the research that I did, including reaching out to the Idaho Immunization Coalition Executive Director and State Public Health, they were not aware of any specific legislation, but there was some concerns raised by members of the legislature that IRIS was being misused as it was intended, where adult COVID vaccines were being entered and tracked. And that was an issue between the legislature and the Department of Health and Welfare, who manages IRIS. They moved that over to the Attorney General's office for an opinion. And to my knowledge, at least as of today, I have not been able to gain any further information, including I reached out to Health and Welfare earlier this week and did not get a response. So I'm not sure what the status is on that, but as far as specific legislation related to IRIS, there were no bills that I could find.
Okay, thank you, Russ. Any further questions or discussion regarding that Iris situation?
Betty Ann, this is Ted
Okay,
Epperly. Betty
yes,
Ann,
Ted,
this
go
is-
ahead.
Since we have Megan on the meeting today, maybe we could ask Representative Blanksma if she has any other information on that. She might know.
Megan?
Madam Chair, I don't have anything to add at this time.
Okay, thank you. Okay, proceeding on with our agenda, we will go to a review of our vaccine status and distribution update by Natalie Bodine, our Public Health Preparedness Program Manager. Natalie, welcome, and the floor is yours.
Thank you, Madam Chair, and good morning. I'm going to be providing an update on the vaccine planning and distribution efforts for Central District Health. We'll provide an update with Pfizer since the last Board of Health meeting. We'll take a look at our weekly allocation numbers over the last several weeks, and then finish up with a look at some specific data for our jurisdiction from the Idaho Department of Health and Welfare Vaccine Data Dashboard. Next slide, please. So some quick updates on the Pfizer COVID vaccine over the last few weeks. So Pfizer did submit for emergency use authorization for their vaccine for the 12 to 15-year-olds. The FDA did approve that on May 10th. And then CDC's Advisory Committee on Immunization Practices, or ACIP, approved Pfizer and set forth guidelines for administration the next day on May 11th. And what we are hearing so far, just within the little time that Pfizer has been approved for that age group, that providers are seeing a slow uptake of vaccine administration for the 12 to 15-year-old age group. And in some following slides, I will have a little bit more of a breakdown of that vaccination data for that age group in the following slides. Next slide, please. So again, this is a look at our weekly vaccine allocation numbers over the last 5+ months of vaccine distribution for our area. Again, starting our distribution the middle of December. Next slide, please. So this is week 11 through the current week, which is week 24. So that's vaccine that will be delivered to providers next Monday and Tuesday. And would like to point out that starting in week 20, which is week of April 25th, you will see an asterisk on some of the numbers. So CDH was not able to allocate the total number of doses made available to our jurisdiction to providers due to a very sharp decrease in public demand, and providers also having adequate inventory with open appointments. So you'll see on week 20, the number on the left, 7,020 doses. That is the number of Pfizer doses that were made available to our jurisdiction to allocate. And the number on the right with the asterisk, we were able to allocate 3,510 of those doses. Again, for that same week, we received 5,500 doses of Moderna and were able to allocate 2,200 doses. And so you'll see that asterisk over the last several weeks with the sharp decrease in public demand and providers having enough vaccine out there. We continue to not be able to completely allocate all of that vaccine that was made available. And then in week 24, which is next week, the vaccine will be delivered. Just wanted to provide an update. We did set our vaccine allocation plan yesterday afternoon, so these numbers weren't updated quite yet, but we did receive 7,020 doses for allocation. We were able to allocate 2,340 doses of Pfizer. We received 5,500 doses of Moderna to allocate, and we were able to allocate 600 of those doses to provider that will be delivered next week. And then you will see a 0 in the Janssen or Johnson & Johnson doses. We did not receive an allocation of Janssen vaccine, but due to the other districts not using their allocation in previous weeks, there is a little bit of a stockpile of Janssen at the state. So we did have providers that were requesting Johnson & Johnson vaccine. So we did make a request to the state to see if there was some extra. And we were able to get 700 doses of Johnson & Johnson that we allocated to providers. And that will be delivered next week as well. Next slide, please. So the next few slides take a look at data that is off of the Idaho Department of Health and Welfare Vaccine Data Dashboard. This is data that is pulled from the Immunization Reminder and Information System that is managed by the state. And the data here is current through the end of the day on May 18th, so just earlier this week. So you'll see here that we, PhD 4 in the middle of the screen, we are sitting at 51% of 12 plus that's vaccinated for Health District 4. The dark green bar shows percent fully vaccinated. So we are sitting at 46% for Health District 4, which was up from 31% since our last Board of Health meeting. So moving in the right direction. The light green bar shows percent of those that have received at least one dose in a 2-dose series. And we are sitting at 5% for Public Health District 4. Next slide, please. So a couple other graphics here. So the graphic on the right shows doses distributed versus doses administered. So in whole, PhD 4 is at 28% for doses administered. We have distributed 421,306 first and second doses, and we have administered 328,460 doses. So you can see that there's a little bit more of a gap now in between that doses distributed and doses administered. And that directly relates to that drop in public demand and providers having more inventory out there that is taking a little bit longer to get out the door and in arms. Next slide, please. On this slide, this is looking at doses completed by age group. I wanted to pull this one in here as we now have 12 and up that is eligible for vaccine. Again, the age group 12 to 15 just opened up for eligibility on May 11th, so have not had enough time if they've received their first dose to get that second dose. As with Pfizer, it's a 3-week series. So again, this is data that is current through the end of the day on May 18th. So for the 12 to 15-year-old age group, we are sitting at 10.7% that have received at least one dose. And again, 0% fully vaccinated, as it is too soon to complete that 2-dose series. In age group 16 to 17-year-olds, we are sitting at 24.8% that are fully vaccinated. And you can see the age range is broken out there. And of course, our highest group for vaccination is the 75 to 84-year-olds with 83.7% fully vaccinated. Next slide, please. And again, a look at our vaccination rates by county. So we are right in the middle of this graphic. So Ada County is sitting at 52.46% for fully vaccinated. Valley County is sitting at 53.89%. Boise County at 26.04%. And Elmore County at 28.22%. And I do want to mention for Elmore County, our EPI team has been working to gather some aggregate data for vaccine administration at Mountain Home Air Force Base. We know that is a large population there in Elmore County, and they have received some initial numbers. And those numbers are not put into IRIS. So this is a data set that is not represented in the information that you see here. So in taking a look at those aggregate numbers for Mountain Home Air Force Base, We are really looking at Elmore County vaccination rate, maybe closer to 40%. So we'll continue to try to get as much information from Mountain Home as possible. Mountain Home Air Force Base is also reporting that they are one of the bases with the highest vaccine rates in the Air Force. So that is good information to hear. Next slide, please. And that is the end of my vaccine update. I will stand for any questions.
Okay,
Madam
thank you,
Chair, this is
Natalie. Yes, go ahead, Elt.
Natalie, just one quick question. For a while there, Valley County was the highest, and then all of a sudden it looks like Lane County really jumped up. Do you know that they do something different that we didn't do, or is there something that we're missing out on that they got more participation than we did?
Madam Chair?
Yes, go ahead, Natalie.
Yeah, Commissioner Hasbrook, I did notice that Blaine County is sitting at the highest rate per county, and then Valley, and then Ada. And I am not sure of specific efforts there. I know that they've had a really great uptake from the beginning, but I can reach out to my counterparts at Health District 5 and see if I can gather some more information, maybe steal some good ideas.
Well, I see in the news this morning now that New York is offering lottery tickets if you get vaccinated. So that's just an idea that anything that would encourage more participation. Can't say that word today. Thank you.
Okay.
Madam Chair,
further
this is
questions or
Ted.
discussions? Natalie? Yes, go ahead, Ralph.
Madam Chair. Yeah, thank you. Question, Natalie, have you heard any information from the CDC or elsewhere in regards to the potential need for a third dose and the potential incorporation of a third dose into the annual flu vaccine?
Madam Chair?
Yes, go ahead, Natalie.
Yeah, Dr. Epperly, we are hearing rumblings of a booster, but I have not seen anything official come down from CDC or from our state immunization program partners. But we will certainly be keeping our ears open for that. I know that we, of course, are working with our schools as we're looking at back to school vaccines and how COVID may integrate with that. But I will keep you posted.
This is Betty Ann. If I may interject a little bit of what I know about the Pfizer booster issue right here. I actually am in that Pfizer trial, and they have already started administering and contacting people for boosters.
Awesome.
Thank you, Betty. Yeah.
Any further questions for Natalie?
This is Jane. I had one quick question.
Yes, Jane, go ahead.
Natalie, is there anything that we could do that would help you in Boise or Elmore County to increase those rates?
Madam Chair?
Yes, Natalie, go ahead.
Yeah, Dr. Young, I think we have several efforts underway to try to get those vaccination rates up in all of our counties. Of course, we are working with a lot of providers that have that mobile capability or are willing to do workplace or on-site vaccines. You know, of course, taking the vaccine to the people, I think will help us get those rates up. We have talked to our providers about some ideas around incentives and as well as, you know, like Commissioner Hasbrook mentioned, you know, a lottery or, you know, there's states that are getting really creative, coming up with some exciting ideas. So I also know that providers are really looking outside of the box, making themselves available with a vaccine booth at, say, farmers markets or Saturday markets. So, and we are doing a lot of education from Central District Health on our website. We did have just last night a youth vaccine information session with a couple of our providers here from the clinic. So yes, I think we are open to all kinds of creative ideas from the board and others that would help us increase those rates.
Madam Chair, this is Al.
Yes, El, go ahead.
Natalie, can you kind of give me a rundown really quick on what's going on with our inmates and our jail population?
Madam Chair?
Yes, Natalie, go ahead.
Yeah, Commissioner Hasbrook, I'd be happy to. So we have been working with Horizon Health, who is the medical service provider for the Idaho Department of Corrections. They are an approved COVID vaccine provider. So for several weeks, months really, we have been allocating weekly and providing vaccine to them for their population. So that will continue. We have a really great relationship with them. We are also working with our county jails to ensure that they have access either as a provider themselves or that they are connected with a provider that can come and provide that administration of those vaccines at their facility. So Ada County Sheriff's Office is an enrolled provider, so we are allocating vaccine to them so that they can vaccinate their inmate population. In Elmore County, Desert Sage Health Center works closely with the Elmore County Sheriff's Office there, and in Valley County, the detention center in Cascade has a good partnership with Cascade Medical Center. So
So a follow-up, Madam Chair.
Yes, go ahead, El.
So Natalie, are those numbers counted in our general population, or is that a separate data set?
Madam Chair?
Yes, Natalie, go ahead.
My understanding is that information from the jails and from Department of Correction is all put into IRIS, so that should be included in our data set.
Thank you very much.
Any further discussion or questions for Natalie? Okay, hearing none. Natalie, thank you for that update, and we look forward to continuing to improve our numbers. Okay, proceeding on with our agenda, we will go to a review of our COVID-19 status by Kim, but I will turn this over to Russ at this point.
Yeah, thank you very much, Madam Chair. I just wanted to take a quick moment to acknowledge Kim for all that she's done for CDH, and especially this past year. This is going to be Kim's last board meeting. She's leaving CDH at the end of the month. So I just wanted to start by saying that Kim is one of the smartest people I know. She has the most incredible depth and breadth of knowledge of communicable diseases. No matter what question I have asked her, she always has an answer. And most impressive is that she can take really complex topics and explain them in such a way that even I can understand them. And I think that's really helpful when you have subjects like viruses and transmissibility and data to be able to translate that so that our team and our community can understand it. There's no question that COVID put us all to the test this year, including the board. Kim definitely rose to the occasion. She led her team that grew quickly from about 6 staff to over 40. She's not only brilliant, in my opinion, when it comes to communicable diseases, but she proved to be an exceptional organizational leader in a time of crisis. She maintained a steady hand throughout our response, never once backing down or stepping away from the fire. She has given so much to CDH and to our communities over her almost 14-year career with us. I just want to say I will forever be grateful to have had the opportunity to work with Kim, and she'll be deeply missed. I'll turn the time over now to Kim for her final report.
Thank you, Russ. Go ahead, Kim.
Okay, thank you, Madam Chair, and thank you, Russ, for those kind words. I'm not quite sure how to follow that up, but I will say, of course, looking at leaving CDH during a pandemic, there's no ideal time to do that, but I think where we're sitting right now is a good a good point for that transition. You brought up the epidemiology team. They have done so much over the past year, investigating over 55,000 cases of COVID, case reports. And they've just worked tirelessly. And I know where we're sitting right now, they are in a position to be able to continue forward. And I'm hoping that we can move forward with little disruption. I think that during times of challenge, what we see is that people will either rise to the occasion or not. And across the board with CDH, I feel like we have all risen to the occasion and really stepped up to do what's best for the community. And I feel privileged to be part of that. I do want to transition over. I do have a couple of slides for our traditional COVID update. So we'll go over some local data and then look at a little bit with the situation that's going on in India. So next slide. So I'll start off with local data and our local trends. Next slide. Looking at our hospitalizations, when we met last month on April 16th, we had a slight increase in our hospitalizations, and that was occurring as a result of the increase in cases that we saw during March and the beginning part of April. Those case numbers have come down, as I'll show in a minute, and as a result, our hospitalizations have come down as well. Next slide. So starting to look at the county case numbers and the 100 per 100,000 population benchmark. At this point, all 4 of our counties are actually below that 100 per 100,000 benchmark. So that's a really great place for us to be. I think this is the first board meeting where we can say that in quite some time. So Ada County dropped below at the end of April, and we've been staying below. It looks like this week Ada County will stay below that mark as well. Our low point was 289 cases. I think we'll be pretty close to that this week as well. Next slide. So Boise County, we've seen their case numbers have been really low pretty much all year. Some high numbers at the early part of January, but we've been seeing some really nice low numbers from Boise County. So that trend is continuing as well. Next slide. Elmore County, similar to Ada County, dropped below that 100 per 100,000 mark at the end of April and has stayed below. We did see last week that the numbers creeped up again, but it does appear that this week they are on track to stay below that 100 per 100,000 mark. Next slide. And Valley County, similar to Boise County, had higher numbers back in January and into February. I know at one point Valley County was an area of very high concern for me as far as the number of cases that came, but I know that there's been a lot of work within the county, and again, that push for vaccinations as well, and we've seen really low numbers of cases in Valley County, which is a wonderful place to be in. So seeing low single digits consistently over the course of the past couple of months. Next slide. So shifting over a little bit, just looking at COVID worldwide, knowing that what is happening in other parts of the world is going to be impacting us in the U.S. and in Idaho as well. So I want to look a little bit at the situation that's going on in India currently. Next slide. So this slide shows the epidemiological curve for the number of cases in India. And what we're seeing right now is that they are in their second wave of illness. As of a couple of weeks ago, even as late as last week, we were seeing that the numbers of cases being reported on a daily basis were the highest in the world, with 400,000 cases per day on average being reported. Thankfully, we've seen a nice downturn in the number of cases being reported. However, those numbers are still in the 300,000 range per day, so still seeing really high rates of illness. And of course, the thing that this is causing the most concern with are the huge number of hospitalizations and deaths that are occurring as a result of this wave of illness. And as we've seen throughout the U.S., as we've seen here in Idaho, those hospitalizations and deaths are going to continue to occur for weeks to potentially a month or more past when this surge is over. So while they've turned the corner on the number of cases, hopefully we don't see a resurgence. We know that the impacts to the people living in India are going to continue for a while longer. Next slide. So I want to take a minute just to talk about what the contributing factors are that are playing into the second wave of illness in India. I think that there are definitely some lessons to be learned from what's going on there, not only for us in the U.S., but for other countries as well. So, of course, one of the biggest factors is that India has a large population. There are about 1.4 billion people who live in the country. What we're seeing with this particular wave is that cases are occurring in urban areas, which are very densely populated, but we're also seeing cases occur in large numbers in rural areas of the country as well. And another contributing factor is really looking at the healthcare preparedness. So as far as how India is set up, many of their hospitals are located in the urban areas, and access to care in rural locations is much more limited. What we've seen is that after that first wave of illness, some of the hospitals in certain regions did take time to prepare, look at building up their capacity, especially for things like oxygen generation. And in other areas of the country, that preparedness just did not happen. And so we're really seeing that in different regions of the country, the impacts of the second wave of illness are starkly different from one another. And unfortunately, those areas, those regions where preparedness wasn't as high are areas where we're seeing many more deaths due to COVID. Another factor that played a role, unfortunately, after that first wave of illness and moving through the winter and into the spring, there was a belief among the government in India that they had reached herd immunity. Unfortunately, as we can see, that is very much not the case. Their vaccination rate right now, about 3% of the population has been vaccinated. And so I think they were relying on the natural immunity coming through the infections from that first wave and what they've been seeing throughout. And that was by no means enough to be able to protect them from the second wave that came through. So what happened was there was this belief in herd immunity, mitigation measures were relaxed, and there were a number of large gatherings, both political and religious gatherings that occurred. And we saw that there were super spreader type events that went on, and that's really what fueled the increase in the number of cases. And then partially a result of this surge, partially something that was driving this surge is the new variant that's come out of India. So this B.1.617 variant. And I do want to take a minute to talk about that in a little bit more detail. So next slide. So the B.1.617 variant it's been dubbed in the media as the double mutant strain. And it's a little bit of a misnomer because the variant does have a number of mutations, but there are two that are most important and that are causing the largest amount of concern in terms of how this is affecting people. So the first mutation that occurred was a spike protein mutation. This is similar to what we've seen in the California variants that are circulating and is believed to cause increased transmissibility of the virus. The second mutation that we see is one that's similar to mutations in the South African and the Brazilian variants. And this is one that's believed to make the virus have an increased potential of evading the immune system. So what we saw with the Brazil variant is that we had larger numbers of people who were being reinfected by this virus, even though they had had COVID previously. As far as how this is playing out, I think it's a little bit too soon to say. We know at this point that from data that's been collected so far, our current vaccines do provide protection against this Indian variant. And so I think it's a little bit soon to say as far as what that particular mutation is going to do on a larger scale. Going back to the transmissibility, it is believed to be more transmissible than the B.1.1.7 variant. That's the British variant that is pretty common throughout the U.S. right now. I've read some estimates that this variant may be 50% more transmissible than the British variant. So again, a huge potential as we're looking at areas of potentially low vaccination rates plus relaxed mitigation, that we may still see large outbreaks. I know right now there's a part of Great Britain that's experiencing a pretty large outbreak as a result of this variant, and I think it's one that we need to keep an eye on. As the variant gets a foothold in an area, it has the potential to wreak havoc. And speaking of the variants being detected, we did have one instance of an individual with international travel who was confirmed to have had illness as a result of this variant. As of this point right now, we aren't aware of other cases. We aren't aware of transmission as a result, but it is a warning to us, I think, in many ways that as we progress forward, these variants are going to be the thing that we need to keep an eye on. So far, I think we've been in a good place in that the vaccines that we have available to us are providing good coverage against these variants of the virus. But that may not always be the case. And as long as we have high transmission, not only locally, but in other areas of the world, that's something that we're going to need to really keep an eye on, because we don't know where that next variant is going to crop up and what mutations it may have. So again, even though our numbers are low, and I think that's something that we need to be proud of and continue to work toward that bit of normalcy that we can get back, we do still need to keep our eye on what's going on worldwide and recognize that we're not done with COVID yet. And that's the end of my report. I'm happy to take questions.
Okay, thank you, Kim. The floor is open for questions for Kim.
Yeah, this is Ted Epperly.
Yes, Ted, go ahead.
So, Kim, a comment and a question. First, the comment. I want to personally thank you as well for being such a marvelous epidemiologist and public health professional. I think you've done a real service for our area with your absolute evidence-based approach, Kim, to the data, so that we could try to make the best decisions we possibly could for the community. So I want to personally thank you for that on behalf of, I think, almost all of our healthcare professionals in our area. Thank you for that. My question to you, Kim, is I can't help but notice that there has been some increased animal transmissibility as well. Initially, it was with minks, both in the Netherlands, Denmark, even in Utah, and now increased data that's starting to emerge about other animal species as well. Your thoughts in regards to, has this gone bigger than just humans in regards to the disease outbreak, and what ramifications might that have?
Madam Chair, Dr. Epperly, first off, Dr. Epperly, thank you for your kind words. It means a lot. And to address your question, I think you're right. We know that coronaviruses are able to infect other animals. And as part of the earliest guidance that was coming out of CDC for those individuals who were known to be infectious, it was advised for them to isolate away from their pets, just not knowing how transmissible they could be to dogs, cats, birds, and whatnot. And I think what we are seeing is, just with this high amount of illness throughout the world and a rapidly mutating virus, that there are going to be some strains of this virus that have the potential to infect other animal species. And, you know, perhaps that's even more of a reason for us to look at continuing to keep up our mitigation measures, just not knowing what animal populations could potentially be decimated as a result as well. I think it's something that we do need to keep an eye on moving forward.
Thank you, Kim.
Thank you. Any further questions for Kim?
Madam Chair, this is Jane. I just had a comment.
Yes, Jane, go ahead.
I just wanted to thank you for all of your education and your attitude through all of this and being able to help us role model for everybody how to get through a pandemic. And I wish you all the luck in the world. Thank you.
Thank you, Dr. Young.
Any further comments? Well, hearing none, Kim, as board chair, I would like to echo all of the kind words that you have just heard, and for your, your wonderful expertise, and for your future, I wish you great joy and success. So thank you once again.
Thank you so much.
Okay, proceeding on with our agenda. We are moving along quite well, so I'm going to go to Commissioner Hasbrook for an update on our Public Health District's Executive Council. El?
Madam Chair, thank you. As you guys know, the Executive Council, we met on a weekly basis while the House Bill 316 was going through the process. We hired Mike Kane as our lobbyist. We had to extend that contract. We did a 3-month contract and we had to extend a little longer. As you guys know, the legislature went a little longer, but he came back and decided to do that on an hourly basis. So it shouldn't be too much more money. We're done with that contract now, but I expect a little bit more from him on that. We were successful. We got just about everything we wanted in the bill done. And I really must push or emphasize to the board that IAC was a very great help on this. Seth at IAC helped us a great deal on meeting these legislators and sitting down in these site rooms with these guys and talking this through. I think our IAC dues were well earned this year, and just wanted to show support for both Seth and for Mike Kane. Right now, the next thing on our agenda is the IAB, that is in June, and I believe it's 1:30. It's only a couple hours, yeah. And I'm sure you guys will be getting information. I hope you guys can join that board meeting. If not, please be sure and get your proxies in, because Southwest District has introduced a resolution that health districts will not be able to do mask mandates anymore. So we need your vote. Make sure you stay involved with that. Other than that, that's about all I have. I take questions. Anybody has questions?
Okay, thank you, El. Any questions for El? Okay, hearing none, I will move on then to our next agenda item, which is a discussion and vote on board elected officials. So the floor is open for discussion.
Madam Chair?
Yes, Russ, go ahead.
Russ, yeah, I just wanted to just give a real quick summary before the board discusses this item, is that per the bylaws, we have 3 positions. We have a chair, a vice chair, and a trustee. And each of those serve 2-year terms, but no more than 3 consecutive 2-year terms. So right now what we have is Betty Ann, you're the chair, and you are finishing up your second 2-year term. Megan Blanksma is finishing up her second 2-year term as vice chair, and El is finishing up his third 2-year term. So unfortunately, he's not, I'm certain he's very disappointed he's not able to serve for another term, but could run for one of the other seats. And the only other thing I wanted to point out is that the Executive Council was created about 2 years ago, 2 or 3 years ago, and that was kind of in response to a conversation that was had about the Board of Trustees. The Board of Trustees have one very specific function in Idaho Code, and that's to determine the appropriation formula for the distribution of state general funds. So that That's, again, clearly defined for the Board of Trustees. So the Executive Council was created, and we don't have it in bylaws, but by default, our trustee has served as the Executive Council member. So that's what I have for you, and we need to, you all will need to vote today to determine who you want as your chair, vice chair, and trustee, and the positions will take effect immediately. Turn it back over to you, Betty Ann.
Okay, thank you, Russ. Okay, the floor is open for discussion or nominations.
Madam Chair, this is Al.
Yes, El, go ahead.
Yes, I'd like to make a motion that we go ahead and renew the chairman and vice chairman positions and keep Betty Ann and Megan in those positions for their last term.
Megan, are you okay with that? I'm not hearing Megan. So,
Madam Chair, I think Megan had another conflict this morning, and she was going to try to rejoin. She just texted me a bit ago, so she may be still taking care of that other issue.
oh, okay. So, well, I'd be willing to do a final stint if you guys are willing to put up with me.
Yep.
I would appreciate it.
El, I'm sorry, did you put that in the form of a motion, El?
I did, yes.
Okay, is
I
there a
second.
second to that motion? Okay. The motion's been made and seconded. Hearing no further discussion, I'll call for a vote by county for the chair and vice chair positions. Dr. Young.
Jane Young, aye.
Dr. Epperly.
Ed Epperly abstain.
Okay. Raul Labrador.
Raul Labrador, aye.
Boise County. Can't hear it. And Elmore County, evidently Megan is off. Valley County.
Commissioner Ashbrook, aye.
Okay. That gives us, that isn't a majority, is it, with our absence in our... Okay, Director Duke, what is your suggestion at this point? The motion fails?
So we have you, Raul, Jane, and Ellen. So we have majority.
So we do have a majority. Okay, that's right. I'm not counting myself. Okay, thank you. So that motion does pass, and discussion is open for nominations for executive, for the trustee for the Executive Council.
I would nominate Dr. Epperly.
Okay, thank you, Jane. Is there a second?
This is Zell, I'll second.
Okay, thank you. Any further discussion?
This is Raul Labrador. I believe that Dr. Epperly's appointment ends here at the end of the month. So, and I'm not sure that Ada County has reappointed him. So I'm just raising that as an issue.
Everybody's looking at you now.
Okay, thank you. I guess we don't have a decision on that yet at this point. So, as having no decision, we can go ahead with that nomination. Correct?
Madam Chair, this is Russ.
Yes. Yes. Go ahead.
Yeah, I think that's up to the preference of the board. Dr. Epperly is currently serving on behalf of Ada County and also as the board physician member. So until a decision is made by Ada County, I think it's appropriate to move forward. And if things change, then the board would take it up either at a special meeting or wait until August.
Okay. All right. Sounds reasonable to me too. Okay. So we have a motion and a second for Dr. Epperly to serve on the Executive Council. And I will call for a vote by county, starting with Dr. Young.
Jane Young, aye.
Dr. Epperly.
Ted Epperly, abstain.
Raul Labrador.
Raul Labrador, abstain.
Boise County, Commissioner Sturm. Elmore County, Megan Blanksmile, absent. So Valley County.
Commissioner Hasbrook, aye.
Okay, and I can vote for Elmore County, so Elmore, I will vote yes. So that does give us a majority to have Ted serve on the Executive Council. So, okay, thank you, folks. All right, we will proceed with our agenda and have a district director update by Russ.
Thank you, Madam Chair. There's two topics I wanted to talk about. One of them, Commissioner Hasbrook has already brought up, and that is the Thursday, June 17th, Idaho Association of Local Boards of Health meeting. It will be virtual. Twin Falls Public Health District 5 is the host this year. And at this point, we only have one Board of Health member from Central District Health who plans to attend, and that's Commissioner Hasbrook. So, as he noted, to ensure that we have representation at that meeting, it's really important that you provide your proxies to Donna so that we have them to provide to Public Health District 5 so he can vote on our behalf. And that's really all I have on that. If you do plan to attend, it'd be ideal if you could let Donna know ASAP so she can pass that information on to Public Health District 5. The other topic is directly related, and that's the Idaho Association of Local Boards of Health meeting for next year. So Public Health District 4 is next in line, so we would be the host of that meeting. And the decision point that I introduced to you at the April Board of Health meeting is what is your preference? And I think the first thing to decide before we talk about possible dates and locations would be, do you want to do the more traditional, what has been a day-and-a-half meeting in person, or is it your preference that we continue with the virtual meetings and the focus has been just the business meeting? That's what we did last year, and that's what we're doing this year. So, with that, obviously, there's a lot less time and effort for planning, a lot less cost because board members and staff aren't traveling to the location, host location from all over the state. But that's your decision to make because we are the host in 2022, and so I'd like to get your thoughts in your direction, and then based on that, we can have the second discussion, decide dates and locations if we're going to have it in person and a normal day-and-a-half meeting.
Okay, thank you, Russ. This is Betty Ann, and just for my personal preference, I would prefer that we continue to have that virtually in the interest of the meetings seem to stay more focused on what we need to accomplish as well as the financial savings to the districts. Just my 2 cents worth. Any thoughts
Madam
from
Chair,
the rest? Yes,
this
Jane,
is
go
Jane.
ahead.
I agree with you. Having it virtually.
Okay, thank you, Jane.
Madam Chair, this is Al.
Yes, Al, go ahead.
Not that I'm disagreeable, Fart, but I think we need to start getting back together as a group, not only for IAB, but for this meeting as well. I think it's time that we show the public that we are not afraid to meet in person. And I miss seeing everybody's faces and having those side conversations and getting to know each other on a more personal basis. I do realize that IAB is an expensive ordeal, but remember, we pay dues into IAB just for that function. Sometime we've got to come back together as a people and stop doing this stuff on a screen. I had one the other day that was a 3.5 hour Zoom. That was probably half of it was, IT problems and people muted and phones dying and not enough broadband, and I'm getting really sick and tired of them. But so my vote is to let's get back together and start doing like we used to do.
Okay, thank you, El. We do not need to make that decision at this time, do we, Russ?
Madam Chair, we don't need to make the decision. Traditionally, the host health district will announce at the annual meeting the date and location. But if we don't have it, we won't have it. Now, that would be done on the 17th if you guys want to make a decision today. Otherwise, we'll discuss it again on August 20th. But that's your choice.
Madam Chair, this is Raul.
Yes, Raul.
So I had no opinion on this until I heard Elt speak, and I actually agree with him. I was ambivalent about it, but I do think it's time for us to meet together as a group. Many of you haven't even met in person yet. So I think for us to meet as a group and then for the larger gathering also to be in person, I think I would lean in that direction as well.
Betty Ann,
Thank you.
Betty Ann, this is
Yes,
Ted
Ted.
Epperle.
Go ahead.
I would agree as well with both Elt's comments and Raul's. I think it would be good for the board to meet again like that. I think the time has arrived. Most, if not all of us, are vaccinated. And I think that would be a meaningful meeting together, personally.
Okay, thank you, Ted. Okay, since we don't have all of our board present, Russ, is it okay if we wait and announce at the meeting coming up in June that will be that meeting venue will to be determined and announced? I know we have had that happen at IAB in previous years.
Right, Madam Chair. So Commissioner Hasbrook will be there, and when that agenda item comes up, he can just let the participating board members from around the state know that a decision hasn't been made and it'll be forthcoming.
Okay, thank you, Russ. That brings us to the end of our agenda for today. I will ask for a motion for adjournment at this time and let me announce prior to...
Madam Chair, this is
Yes.
Raul Labrador.
Yes, Raul.
At some point, we had discussed that we may need to discuss the wearing of masks of children, and I had asked Russ if he would put that on the agenda. And I wonder if we have time to talk about that.
Russ, would you like to address that, please?
Yeah, Madam Chair, I'd be glad to do that. I had remembered that now that Raul brought that up, and I was going to ask Kim to speak to that, but I think she's dropped off the meeting. But the short answer is, and I think this is an important point right now, based on where we're at with the pandemic, our numbers are looking good, not completely out of the woods as we watched what happened in India, but Central District Health has very much aligned our recommendations with those of the Centers for Disease Control and Prevention. And again, the point that needs to be made is the idea of not wearing a mask is out in public and in gatherings is for vaccinated people only. And what we're starting to see throughout our health district and hearing from many of our members of our community is the CDC guidance, which we support, has been taken, has been interpreted as back to normal. And that's not the case at all. So that's the first point. People who are unvaccinated, when they're around large crowds and conferences and whatever people might be planning to do, they should continue to wear a mask. So to the specific question that Raul has, children under the age of 12 have had no opportunity to receive a vaccine because it's not licensed emergency use authorization for that age group. The 12 to 15-year-olds only very recently had access to the vaccine. So for the most part, they would not have had the opportunity to receive both doses because it's the Pfizer vaccine plus 2 weeks. And even among the 16, 17-year-old and I guess up to 18-year-olds thinking about schools, there's still a large percent of that population who have not yet been vaccinated. So in summary, not wearing masks and us lifting our public health advisory really applies to the vaccinated population, not the unvaccinated population. And for the most part, children in our state and in our health district are not vaccinated at this time.
Madam Chair, this is Raul.
Yes, Raul, go ahead.
This is the number one issue I have from people that approach me about CDH is why are our children wearing masks when they're not spreading it, when they're not getting it? So I just want to have a discussion about the science. The CDC has already shown that there's evidence that the CDC has been relying on the teachers union to set their guidelines when the guidelines have been a little bit too stringent for schools. I'm not sure that we really have any science saying that children are super spreaders. They're not getting the disease. They're not dying from the disease at very large numbers. Obviously, any child who gets it or dies from it is a tragedy for all of us. But the numbers are quite small. And the people that we're trying to protect are the teachers or the adults that are dealing with them, and they are vaccinated. So I just don't see any reason why, especially during the summer when it's going to be hot, with that, we have a guidance that is saying that outdoor activities for children, summer camps, day scares, schools, youth sports, that we are requiring children to wear these masks. I just don't think it's science-based, and I don't think it makes any sense. In fact, I'm worried that we're harming these kids. So I really I appreciate what Russ has done. I appreciate the new public health advisory lifting even for those who are vaccinated. But I just don't see any need at all for children to have this this requirement. And what happens, as you know, it's not a requirement or a mandate, but the fact that we have it as a suggestion from CDH means that every school, every summer camp is going to do it. And I want somebody to explain to me the science behind this, because there's no science stating that children are spreading it or getting it in large numbers. In fact, there's a New York Magazine article that just came out that on May 19th, it says that new research suggests number of kids hospitalized for COVID is overcounted by almost 50%. So even though the numbers are low, even those numbers are exaggerated.
Madam Chair, this is Ted Epperly.
Oh, yes, Ted, go ahead.
Yeah, Raul, I appreciate you bringing up the topic. It is an important one, and I think it's good for the public to be aware of our thinking about this. What I would add to the conversation is that there is good evidence and data, Raul, that shows that the B117 variant from the United Kingdom is much more transmissible to children than the wild type virus that we've been dealing with. And what the data from Europe and the United Kingdom showed was that the percent increase in children went from about 3% with the wild type D614G virus to about 50%, 45% with children in the age group of 1 year old to 12 years old. Now, what we're seeing in the United States at this point is a conversion of the type of infection we're having in the United States from the initial wild type virus to the B117 variant. So what we're seeing overall is a shift to the left, if you will, a shift to younger age group population that's getting the infection. The older people, most have been vaccinated, which is good, are finding immunity from that virus, but there's a shift into the younger unvaccinated age groups. And so I would agree with Ross and the CDC that for outdoor activities, there's certainly no reason that people need to be masked, kids need to be masked as long as they're socially distanced, doing their activities, enjoying life. I would agree. But inside, with children in close proximity, no social distancing, then I think masks are still important. And I think, Raul, the data would support that. And I'll stop.
Okay, any further discussion regarding masking children?
Madam Chair, this is Al.
Yes, Al, go ahead.
Hey, I'm gonna throw my 2.5 cents in worth on this as well. You know, in the beginning, the reason why we did the mask mandate is because we were trying to not overwhelm our hospitals. And we succeeded in that. We brought those numbers down. We kept our hospitals stable. That was the goal. And my feeling is that I know my second grader granddaughter, they're still wearing masks in the classroom every day. And I think that if we start seeing an uptick in little kids being hospitalized, then I think we need to come back and look at those mandates or those recommendations or whatever you want to call them. But part of herd immunity is, you know, passing this stuff around and getting through it and getting over it with little kids. And we know that the death rate is very low on little kids. So my feeling is I think we need to kind of ease up on some of that. Let's watch, see what happens with hospital administration admits, and if the disease gets progressively worse, then we come back and maybe tighten some of those rules back down on younger kids in confined spaces. But you have to remember in the beginning, it was if you cannot social distance, then wear a mask. And that was the original intent. I just think that we've got to let Mother Nature kind of go with some of this to see what happens and then adjust our practices if it gets worse in that age group. That's just my opinion.
This is Raul.
Yes, Raul, go ahead.
I could not agree with Elk more. You know, the CDC also says that children should eat fewer hamburgers, and we're not going around mandating that children eat fewer hamburgers. There's a lot of recommendations that the CDC makes that actually have a huge impact on the health of our children. And, you know, eating better, eating vegetables, all those things would actually save more kids than wearing masks. So, and we're not going around making these kind of recommendations or mandates that are affecting their psychology, their well-being, their social interaction. I will be making a motion at the next meeting, and I want us all to be prepared to have a discussion about this for us to stop with these recommendations I need to figure out the proper way, and I'll talk to Russ about it, but I just think enough is enough. I understand Dr. Epperly's concern. I understand the concern of most health experts, but we have really screwed up our kids over the last year and a half. We have done things that have impacted them, and in some ways they're never going to recover from. And I think it's time to stop, and I think it's time to get back to normal. And I think it's ridiculous for us to have kids in youth camps and schools wearing masks. And I hope that we can prevent that in the future.
Okay, thank you.
Madam Chair, this is Jane. I had one more comment.
Yes, Jane, go ahead.
If there is a way in our thinking to separate out our judgment of how it feels to wear a mask as opposed to how it is actually affecting the kids, because when you're around the kids in schools and sports, they're taking it as natural, and that's the way it is, and it's not something that they're as concerned about as perhaps we are. So in our thinking going forward, that might be something to consider.
Madam Chair, this is Raul again. If you read the letters that we received, one of them was from a therapist that says that he receives 4 new consults per day of kids who are being affected by the mask mandate. So, and there's numerous reports of children being affected. And if you read some of the teachers that say that they're not being able to have the same interaction that they have with their children, we need to have normal social interactions with each other, and children in particular need to be able to see each other's faces and expressions. And I just think time has come. You know, like it was stated earlier, the reason for the mandate is to stop the spread and to prevent the hospitals from being overwhelmed. We have done that, thankfully, and I think we can get back to normal life.
Madam Chair, this is Elk.
Yes, Elk, go ahead.
I make a motion, we adjourn.
Thank you.
I'll second.
For a second.
This is Jane. I'll second.
Thank you. Motion's been made and seconded for adjournment. Let me announce that our next meeting is scheduled for August 20th at 8:30 in the morning. So having said that, with the motion being made and seconded, hearing no further discussion, I will call for a vote by county, starting with Dr. Young.
Jane Young, aye.
Dr. Epperly.
Ed Epperly, aye.
Raul Labrador.
Raul Labrador, aye.
Commissioner Sturm. Representative Blanksma. Commissioner Hasbrook.
Aye.
Okay, thank you, folks. The motion has passed. Have a wonderful summer, and we will talk to you in August. Thank you so much. Goodbye.
Thank you, Betty Ann. Stay well, all.
Good summers.
I don't think we ever had spring up there. We're still in winter.